Hey everyone, and welcome. Today, we're going to break down a really fascinating medical condition called a hemangioma, and we'll look at how it's spotted using some truly unique visual patterns. All right, let's kick things off with a question that might sound a little weird. What on earth could polka dots and jail bars have to do with your spine? I know it sounds like a riddle, but I promise you it's all going to click by the time we're done here. So, to get to the bottom of that riddle, we've got to get to know the star of our show today. So what exactly is a hemangioma? Okay, so a hemangioma is a benign lesion. And benign is just the medical way of saying it's not cancerous, which is always good news. The term you see here, hamartoma, sounds complicated, but it's really not. Think of it like a jumbled up, disorganized pile of normal tissue that's just in the wrong place. In this case, it's a tangle of blood vessels that is formed right inside a bone. Okay, so that naturally brings up the next question, right? Like, how common are these things, really? And is there anyone who's more likely to get them? Well, they're not something you see every single day, but they're not exactly a unicorn either. They make up just about 1 to 1.5% of all primary bone growths. So the key takeaway here is they're uncommon for sure, but definitely not unheard of. And what about age? When do these things tend to show up? Well, the sweet spot, if you can call it that, seems to be when people are in their 40s. Though it's worth pointing out that they can sometimes appear in younger adults, too. All right, so we've got the what and the who. Now for the where. Where in the body do these things actually set up shop? And believe it or not, they're kind of picky. As you can see right here, they have a huge preference for a couple of main spots. A whopping 50% of them, that's half, show up in the vertebrae. The little bones that stack up to make your spine. The skull comes in at a distant second, with about 20% of cases. And if we zoom in even closer on the spine, they really favor the lower thoracic and upper lumbar regions. So think middle of your back down to your lower back, that's their prime real estate. They can even pop up in the tiny bones in your hands and feet sometimes. Okay, now we're getting to my favorite part, the really cool visual stuff. How do doctors even know they're looking at one of these? Well, it turns out hemangiomas leave behind some incredibly unique fingerprints. And this is where it all comes together. Radiologists have these two super distinct patterns they look for. But here's the catch. What they see completely depends on the kind of scan they're using. You've got the jail bar or corduroy look on an X-ray, and then this polka dot pattern on a CT scan. So how in the world does this happen? Well, think of the inside of your bone kind of like a building with lots of vertical and horizontal support beams. What the hemangioma does is it basically eats away at the horizontal beams. So what you're left with are these thick, strong, vertical beams standing all alone. And on an X-ray, yep, they look just like jail bars, or the stripes on a corduroy jacket. Pretty wild, right? But here's where it gets even cooler. If you take a slice of that same bone and look at it with a CT scan, which gives you a different angle, like you're looking down the length of the beams, those same vertical lines now look like, you guessed it, polka dots. It's the exact same structure, just seen from a new perspective. And that is how polka dots and jail bars have everything to do with your spine. See? Told you it would make sense? Okay, so a radiologist spots these telltale jail bars or polka dots. They know what it is. What happens then? What's the game plan? Well, since these are benign, remember, not cancerous, a lot of the time the approach is just to keep an eye on it. No big intervention needed. But for the ones that are actually causing problems or symptoms, the go-to treatment or source points to is radiotherapy.